Hello, I am Korean medicine doctor and a medical doctor, Youngjun Lee. First, it's the definition and classification of tic disorder and Tourette syndrome. Tic disorder and Tourette syndrome are neuropsychiatric diseases common amongst children and adolescents. There are various types of tic disorders. First, it's uncontrollable, sudden, and repetitive movement that appear as motor tic. There is also vocal tic, which appears in various types of sound. When vocal and motor tic are combined, it's called a complex tic. When the symptoms of complex tic last for more than a year, it's called a Tourette syndrome. Let us take a look at the types of motor and vocal tic in detail. First, it's the motor tic. There are two major types of motor tic. Simple motor tic appears in one muscle group. Complex motor tic appears simultaneously in more than two muscle groups. In what form does simple motor tic appear? It can appear in the forms of nose twitching, blinking and rolling eyeballs, neck and head spasm or shaking, head leaning back or lip biting, and also face grimacing or shoulder shrugging. Usually, complex motor tic appears in motions when one is kicking, skipping, or jumping as he or she walks. Also, it can appear in the forms of imitating others' movement, flaring nostrils and sniffing, self-hitting, and twirling in place. Other examples include bending forward and running. Next, let's take a look at vocal tic in detail. Vocal tic is also mainly divided into simple and complex vocal tic. In what way does simple vocal tic appear? Normally, it appears as dry coughing, choking sound, and throat clearing. It can also appear as animal noises, snuffling, muttering, and saying syllables such as a, or ha. Complex vocal tic appears in a very different form compared to simple motor tic. It includes repetition of words spoken by others, repetition of one's own spoken words or sentences, stuttering, and saying obscene words and/or swearing. It can appear in forms of animal sounds or shouting as well. When symptoms temporarily and repeatedly appear and disappear before the age of 18, it's called a transient tic disorder. And when either one of motor or vocal tic repeatedly appears and disappears for over a year, it's called a chronic tic disorder. When an individual has multiple motor and vocal tic for over a year, it is called a Tourette syndrome, the most intractable disease. As I treated young patients with tic disorder, I noticed several things they have in common. There were many children with attention deficit disorder and hyperactivity disorder. It was also very common to see children with combined symptoms of impulse control disorder, learning disability, depression, anxiety, and obsessive compulsive disorder. This implies that diseases such as tic disorder and Tourette syndrome are accompanied by emotional problems. And it is also implying that it can be treated at the same time. In this video, I have introduced the definition and classification of tic disorder and Tourette syndrome. In the next video, I will explain in detail about the cause of tic disorder and Tourette syndrome. Thank you.